Hey everyone, Dr. Chris, orthopedic surgeon and sports medicine physician, and today we're going to talk about Tiger Woods' comeback after spinal fusion.
Okay.
So as some of you may have heard, or perhaps all of you may have heard, Tiger Woods just won the 2019 Masters.
Tiger completes one of the greatest comebacks in Masters history.
That's pretty significant. Just in and of itself is significant. But it is even more significant because Tiger Woods has come back after spinal surgery. And because I really don't follow golf that much, I had to go and look up some of the things from Tiger Woods' past so that I could tell you a little bit about the things that he's experienced. This is the Cole's Notes version of Tiger Woods' history. In 1996, Tiger Woods went pro. In 1997, he won the Masters by 12 shots. In 2001, he created the Tiger Slam. He was the first golfer to hold all 4 majors simultaneously. In 2005, he performed the incredible chick shot. Some say this is the greatest Masters shot of all time.
Turns out it's genetic.
In June of 2008, he underwent ACL surgeries 8 days after winning the US Open. In 2006, unfortunately, his father Earl died, but he went on to win his 3rd Open Championship and his 11th major. In August of 2007, he tore his ACL in his left knee while running on the golf course after the British Open. In April of 2008, Tiger Woods underwent a knee scope for cartilage damage in his knee. In June of 2008, he underwent ACL surgeries 8 days after winning the US Open. In 2009, he was involved in a car accident and a cheating scandal. In 2010, he got divorced from his wife. He also withdrew from the Players' Championship citing bulging discs and neck issues. In 2012, he complained of low back problems from sleeping on a soft mattress. In 2013, he dropped his knees after a shot at the Pro-Am tournament at the Barclays, complaining of back spasms. In 2014, he withdrew from several tournaments due to back pain, and it was at this point that he finally decided to have his back problems addressed surgically. In March of 2014, Tiger Woods underwent a microdiscectomy for a pinched nerve in his lumbar spine. In September of 2015, he underwent his 2nd microdiscectomy to remove a disc fragment that was compressing a nerve. Later, in October 2015, he underwent another procedure to relieve discomfort. In April of 2017, he underwent his 4th back surgery, a spinal decompression and spinal fusion. And finally, in 2019, Tiger Woods won the Masters in what some say is the greatest sport comeback of all time.
You know that I'm the cream of the crop.
So now you know a little bit about what has gone on with Tiger Woods in the past and what has led up to this momentous occasion of Tiger Woods winning the Masters in 2019. So one thing that's interesting to note is that with all of the other injuries that he had, like his meniscal tear, cartilage damage, ACL tear, there are so many other factors that may have contributed to the fact that Tiger Woods had back pain. With the ACL tears and the meniscal injuries in particular, it is conceivable that his gait may have been changed for a period of time when he was injured, and that may have contributed to the back pain that he would suffer.
Okay, yeah.
So Tiger Woods first underwent surgery in 2014 for a pinched nerve. So what exactly is that? A pinched nerve is any spinal nerve that has been compressed by disc material that has been extruded out of the vertebral disc between 2 vertebral segments. Think of the vertebral disc, the disc in between 2 of your spinal vertebrae segments, as a Boston cream donut. We've talked about this before. It has 2 components, a hard outer shell, which is rubbery, and then a soft inner component, which is kind of like the cream of a Boston donut, less rubbery and more spongy. And these vertebral discs are kind of like the shock absorbers in between segments of the vertebral cone. Sometimes, if enough force is applied to the disc, the rubbery coating outside of the disc can split or rupture, and some of the soft contents can be pushed out through this rupture outside of the vertebral disc and into the spinal canal. If enough of this material comes out, it can compress on the spinal cord or one or more of the spinal roots as they exit off the spinal cord. Prior to this surgery, Tiger Woods was having a significant amount of low back pain and pain radiating down from his low back into his lower extremities. At some point, Tiger and his surgeon decided to treat this problem surgically. Now, usually, a microdiscectomy is a relatively minor procedure. This is a procedure that is usually performed through a very small incision and using the assistance of a microscope. Using specially designed instruments, the space in between 2 vertebrae is entered and the offending piece of disc material is located. It is taken out so that there is no longer any disc material compressing on the nerve. This is enough to relieve the pain symptoms that the person was experiencing prior to the surgery. And just to be clear so that you understand, here we are taking out some of the spongy stuff that used to be on the inside of the vertebral disc, or Boston cream donut, but was pushed out of the vertebral disc, Boston cream donut, and into the spinal canal. Now some of you are gonna ask, do you like just bend forward and your vertebral disc blows up and all of a sudden you have a disc herniation? Usually it's from repetitive forward flexion, stop doing those crunches, or from loading the spinal column when you are in forward flexion. Think really, really bad deadlift. But it could also happen from thousands of repetitions of twisting the spine as you were swinging a golf club. Because after all, he's a professional golfer, and that's what he does all day long, every day. It's less likely to occur in this manner, but if you did that same movement thousands upon thousands upon thousands of times, you just might herniate a disc. So in 2015, he underwent a second microdiscectomy operation. So this is only 18 months after he underwent the first microdiscectomy operation.
What are you talking about, man?
Usually, if you've gotten all the material the first time and you've rehabilitated your back appropriately, you will not have a second disc herniation in such a short period of time. However, here there could be another possible etiology. When you herniate the disc, you can herniate the disc in several places. Because the contents of the disc are soft and they can easily be moved around, sometimes the disc material, particularly if a lot of it gets pushed outside of the disc, will move around and some of it will be pushed off to the side. Disc material, which may have been pushed out into the far lateral recess, may not have been seen during the original operation. Then, after Tiger recovered from his operation and rehabilitated from the first procedure, he may have discovered that he continued to have ongoing symptoms in his lower extremities. In October of 2015, only 1 month after his second microdiscectomy, Tiger Woods underwent another procedure to relieve discomfort in his lumbar spine. What the heck is going on? Well, keep in mind, his first 2 surgeries were microdiscectomies performed with the assistance of a microscope through a little hole, like this. And you can imagine, when looking through a little hole like this, even if you're looking through a microscope, you just might not see the whole picture. Using a technique like this, it may be possible for you to miss part of the picture. The other thing to keep in mind is that when you use a technique such as this, although this is better for the patient in terms of incision size, recovery, and damage to the surrounding tissues, your ability to see is very limited because you need to use protective sheets down which to put the microscope. They may have decided after 2 microdiscectomy, enough is enough. They finally performed a larger procedure such as a laminotomy or even a laminectomy so that they could see what was going on. And likely they performed this procedure using an open technique. With a laminectomy or laminotomy, they're now going to use a full incision, cutting down through all the layers of the back muscles and formally visualizing the vertebral column with their eyes. There is no documentation to say exactly what he had, but I would venture to guess, because he had had 2 microdiscectomies, that he probably had a full laminectomy procedure performed to remove the entire lamina or the entire roof of one vertebra to gain access, wide access, to the vertebral space to allow them to see everything so that they could remove all the disc material that was present and have free access to the spinal cord and the spinal roots. So if they got all the vertebral material and they performed a full laminectomy at one level, then why the heck are they going back in 2 years later to do another procedure? If you perform a laminectomy, you've now removed the roof of one vertebral segment in the spinal column. And by doing so, you have affected the stability of the spinal column to some degree. In addition, after you've had several microdiscectomies or decompression procedures, obviously there's going to be less material left in between 2 vertebral segments. After 3 decompression procedures, I would venture to guess that there wasn't that much cream left in the Boston cream donut. And when that occurs, you start to have additional pain between those two vertebral bodies because of the lack of cushioning. This now means you have to have another procedure. And this leads us up to the final procedure, which he underwent in April of 2017. Now, in this case, all of the Boston cream donut between two adjacent vertebral bodies is removed. But in this particular case, rather than doing a conventional posterior approach for his lumbar fusion, Tiger Woods underwent an A-lift, or anterior lumbar interbody fusion. The surgeon typically approaches the lower back from the front through the abdomen. When the spine is approached in this manner, the bone graft used for fusion may be placed inside of a cage which is placed in between the two vertebral bodies. This structure can be augmented by plates and screws which are placed on the anterior or the front aspect of the vertebral bodies. And in rare occasions, this may also be supplemented by additional fixation which is placed by conventional means on the back using rods and screws. But in this case, I don't think that happened. But basically, they fixed his back through the front, through his belly.
What ain't no country I ever heard of?
They fixed his back through the front, through his belly. And because they use this approach, there's no traumatization and damage to the muscles of the lumbar spine and lower back, and therefore there is a quicker recovery time after this surgery. So some of you are asking yourself, after spinal fusion, does this do anything to his mobility? Fusion is a fusion is a fusion. The two segments have now become one segment, but there is still movement in the remainder of the spine. However, spinal fusion carries with it a number of risks. If you fuse the spinal column at one level, you gotta transmit the forces that occurred at that level somewhere else. The segment above and the segment below will be more prone to arthritis down the road because the forces at those segments have now been magnified by the fusion of the spinal column in between. In the end, he's mobile enough to be able to do what he needs to do to be successful at golf. Today we've been talking about Tiger Woods and his comeback after spinal fusion. If you're new to the channel, be sure to subscribe, hit the notification bell so that you can be updated when we post new content. If you are a returning member of the intern army, you know what to do. Go hit the like button and share this with a friend. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Tiger completes one of the greatest comebacks in Masters history.